Hello everyone, my name is Alejandro. I'm a ninth semester medical student at the Intercultural University of Chiapas, and I'm going to speak to you about lupus pernio disease. So, lupus pernio is a consequence and manifestation of a rare multisystemic disease known as sarcoidosis, which is a multisystemic inflammatory disease of unknown case. It is characterized by the formation of non-necrotizing granulomas in different organs of the body. These granulomas are clusters of inflammatory cells that can affect organs such as lung, skin, eyes, liver, and lymph nodes. There are various types of sarcoidosis that includes two main clinical courses. The first is a self-limited form in which the disease resolves on its own with about 12 to 36 months, and this occurs in roughly 2/3 of patients. The second is a chronic form which affects about 10 to 30% of patients. In these cases, the disease persists for a longer time and usually requires prolonged medical treatment. The exact causes of sarcoidosis are still unknown, but researchers believe it is related to an overactive immune response. Several factors may contribute to its development. One of them is genetic susceptibility, because the disease sometimes appears in families. Another factor is environmental exposure, such as contact with mold, dust, chemical substances, or infectious agents like bacteria and viruses. These triggers may activate the immune system in susceptible individuals and cause chronic inflammatory and granuloma formation. The clinical manifestations are wide and include sarcoidosis and can affect almost any organ in the body. Many patients experience general symptoms such as fatigue, which occurs in up to 70% of cases. Other common symptoms include fever, weight loss, and enlargement of lymph nodes. The skin is one of the most commonly affected organs, occurring in up to 1/3 of patients. Cutaneous lesions may appear as erythematous macules, papules, plaques, or subcutaneous nodules. In many cases, these lesions are the first sign of the disease. One of the most characteristic skin manifestations is lupus pernio. This condition produces chronic violaceous or purplish plaques, usually located on the nose, cheeks, lips, and ears. So I will share some pictures of the skin of these patients. We can see all these pictures are lesions produced by sarcoidosis in the skin. So, continuing with the presentation, the treatment of sarcoidosis, especially lupus pernio, usually begins with local therapies. The first line treatment includes topical or intralesional corticosteroids, such as triamcinolone injections, which help reduce inflammatory and improve the appearance of the lesions. If these treatments are not effective, systemic therapies may be required. These include oral corticosteroids like prednisone, as well as medications such as hydroxychloroquine or methotrexate. Finally, some lifestyle recommendations can help patients manage the disease. Patients are advised to avoid exposure to cold, since it can worsen skin symptoms. They should also stop smoking because smoking may aggravate inflammation. Another important recommendation is sun protection, as ultraviolet exposure can trigger skin problems. And in addition, stress management and adequate rest are important, since stress and infections can trigger disease flare-ups. So this was a brief talk about this disease, and thank you for your attention.